Thank you so much for joining us for this month's meeting of our remote monitoring working group. Today, we will cover some proposed changes from CMS regarding payment for certain breakthrough devices, as well as an update on the Digital Health Screeners Act of 2026 that was introduced and discussed at a committee hearing earlier this month, as well as a recap of some of the updates from the CMS Access Model that was announced earlier this month, and then our normal member discussion blurb about CTeL research and upcoming events. A few weeks ago, CMS published a proposed rule for its hospital inpatient prospective payment system for fiscal year 2027. And the key point from this, particularly relevant to the digital health and remote monitoring community, is that CMS is proposing some changes to its new technology add-on payment eligibility, which is a program for CMS that allows for Medicare payment for certain breakthrough and new devices. CMS has proposed repealing its alternate pathway for eligibility for this payment, and is now proposing that all payments under this program have to follow the same criteria as the traditional pathway. On the right is a table from CMS talking about the differences between the traditional and alternate pathways. The main difference here is that the alternate pathway does not require a demonstration that the device does not meet the substantial similarity criteria, basically that it is not similar to another existing device, as well as the alternate pathway does not require that the device demonstrate that it meets clinical improvement evidence as well. So under this proposal, this alternate pathway would be repealed, and all devices under the new technology add-on payment pathway would have to go through the traditional one, which does require demonstrating that it is not substantially similar to existing devices and requires demonstration of clinical effectiveness and clinical improvement. When discussing the proposal to repeal this alternate pathway, CMS in the proposed rule said the following: "We believe this proposed requirement will better align spending and value and ultimately support providers in delivering the best data-driven care possible. By requiring all technologies to demonstrate that they offer a substantial clinical improvement as part of our evaluation process, we believe we will be better able to make evidence-based decisions on which technologies should receive these additional payments." And so this is a pretty big change to this new technology program. And in following up on this, a few weeks later, CMS, alongside the FDA, announced a new initiative to kind of help fill that gap, what they're calling RAPID, or Regulatory Alignment for Predictable and Immediate Device Coverage Pathway. And so the goal of this is to, quote, accelerate access to certain FDA designated Class 2 and Class 3 devices for people with Medicare coverage, which would require an investigational device exemption, study that enrolls Medicare beneficiaries, and studies clinical health outcomes agreed upon by the FDA and CMS. And while the specifics of this model have not been published yet, we are expecting that within the coming weeks that we will get a more thorough proposed rule with a 60-day comment period available to the public as well. And so in commentary in the initial announcement on this, CMS said that under this coverage pathway, the agency will issue a proposed national coverage determination the same day an eligible device participating in the pathway receives market authorization from the FDA, triggering the statutorily required 30-day public comment period. And CMS believes that this streamlined approach could enable predictable Medicare national coverage and payment as soon as 2 months after market authorization, compared to approximately a year or more under the current pathway helping Medicare beneficiaries access new technology sooner while increasing transparency, predictability, and cost savings for innovators and clinicians. Again, the specifics of this model and how it will work have not been released yet. We're expecting that to come soon. But in this initial announcement, we see that CMS is instead trying to move towards expediting and facilitating the pathways for review and study to meet some of those evidence and clinical improvement requirements. We will, of course, continue to update the CTeL community as more information about this model comes out, as well as what policies CMS ultimately ends up finalizing in the inpatient prospective payment system rule as well. Any questions here?
No, I think I have to do a little bit more research before I ask any questions. It's good to know that this is being floated out there by CMS.
Certainly, and happy to answer any questions or set up some time to chat if you'd like.
Thanks, Lydia.
I also wanted to highlight out of Congress, the Digital Health Screeners Act of 2026 is a bill that was introduced by Representative Troy Balderson, Republican from Ohio, that more or less seeks to codify legislatively the FDA's recent relaxed guidance on wearables and expanding wellness product eligibility. This was included in a legislative hearing, but was not voted on during this specific hearing. It was more of a discussion-based hearing. And in discussing the bill, members seemed pretty supportive of the goal of expanding access to wearables. Members of Congress, a lot of them talk about their experience with wearables. On the right is a screenshot from an op-ed from Representative Balderson talking about his experience with wearables and why he wants to see this expanded guidance codified through law. However, there were concerns brought up about data privacy, device safety overall, as well as ensuring that data from these devices is interoperable and usable beyond just the device itself. And so this bill hasn't exactly been voted on yet. However, it has had at least one hearing, and so we will continue to update CTeL and CTeL members with any updates on this bill, especially as it pertains to some of these devices and expanding regulatory pathways for those. I also wanted to give an update. We discussed a little bit at our telehealth working group earlier in the month. But again, I also wanted to highlight for the remote monitoring working group and RPM members that CMS has announced the first 150 participants of its access model, the Advancing Chronic Care with Effective Scalable Solutions. This is a model that CMS has proposed to promote outcome-based payments, as well as increased access and use of digital health tools. And in the announcement, CMS said that most of the organizations that were accepted into the model have not previously served Medicare beneficiaries and will bring additional technology-supported care options to help people manage chronic conditions like high blood pressure, diabetes, chronic pain, and depression. In the announcement, CMS also noted that it is extending the deadline to participate in the model to May 15th and that the model will formally launch on July 5th.
Hey, Lydia, I have a couple of questions about the Access program.
Sure.
So I'm assuming, and I don't know if this is a correct assumption or not, but the fact that CMS pushed or extended the deadline to May 15th, were they hoping, do we know if they were hoping to have more participants apply to the program?
Yeah, I think that would be a good sort of intuition about why they didn't explicitly say why they were extending the deadline, but that is likely the case. I think a big driver of this is that when CMS published the payment rates for participants in this model,
Yeah.
that they were pretty lower than was expected. And so I know, at least in the conversations I've been having with folks who were interested in participating in the model, the payment rates were a bit of a hindrance in interest in the model, especially for those. The biggest concern with the payment rates is definitely on the remote monitoring side, given that with lower payment rates, it will probably favor more software-based solutions as opposed to hardware, just because the cost to entry might be a little lower.
Right.
Um, and so we're definitely concerned that because these payment rates are pretty low, that this is affecting a lot of remote monitoring organizations. Um, and so there's likely been a decrease in interest based off of these initial payment rates.
Yeah, so I did a deep dive into the Access program because we had a lot of customers coming to us, asking about it. Um, and obviously, comparatively to like what you would expect on an annualized reimbursement for, billing fee for service for the RPM CPT codes versus what, Access is, willing or planning on paying out at this point, is like 10% or, something like it, give or take. But do you have any sense of whether or not, CMS is in tune to that and whether I know that, it's going to go through the typical cycle every year and they're going to, potentially reevaluate reimbursement rates, but do you have any sense of whether or not, CMS has picked up on that yet and whether or not you anticipate reimbursement becoming more favorable as the program matures?
Yeah, I think the part that they've been particularly targeting organizations who haven't worked with Medicare in the past before might be an indication kind of in what direction they're looking at. Um, it very well may be that because they're working with organizations that haven't really worked with Medicare before, their expectation of payment might be a little different. Um, that could be one potential thought there. Um, I think it's also interesting that when they announced this model, that I believe it would have a 10-year testing period, which is much longer, which I believe is the longest model testing period so far from CMMI. Um, and so I think given that this is a much longer test period, as well as the fact that they are looking more towards um, organizations that do not already participate in Medicare, um, that they might be using this as an opportunity to expand into those kinds of organizations, or that they might just be looking to take whoever would be interested with these payment rates, and go from there.
Got it. I just have a couple more questions about Access. Um, One, did they actually publish or did they publish the actual participants' information? Like, is their marketplace live yet, or it's just the aggregate number that 150 participants were announced?
I believe they did. Uh, yes, they did publish. I can put a link into the chat. The
That'd be
full
great.
list. Um,
Excellent.
and
Thank you.
it's at the bottom. There's a little drop down that says accepted applicants. Um, you'll just have to click the arrow, and that'll drop down with all the applicants.
Okay, great. And then does CTeL have any resources on how access dovetails into like a typical value-based care program like a MSSP or because it'd be interesting to understand what reimbursement looks like for a value-based care or an ACO organization that may be considering also piloting access.
Yeah, we had a webinar um with a lawyer from Holland and Knight, talking a little bit about the access model and what it's kind of doing a little bit differently as opposed to other models. And I just put a link to that webinar in the chat. Um, I think that might be a good place to start. Um, the webinar was pretty comprehensive and kind of its overview of the model as well as what it's kind of doing a little differently. Um, so I think I'd recommend in terms of CTeL resources, checking that out first.
Great. Thank you so much.
Any other questions on access model, new technology add-on payments, or anything else that we didn't get to discuss today?
No, not for me. Thank you so much, Lydia.
For sure. And if you have any follow-up questions or would like to schedule some time to chat one-on-one, I'm always available as well. I did also want to give another boost to our RPM research efforts. We are currently raising funds to conduct a thorough academic study on some of the major policy gaps surrounding remote monitoring reimbursement in three areas, including economic impact of RPM, including savings and utilization, quality outcomes, as well as program integrity concerns. We are currently raising funds for this effort, and if you're interested in contributing, there is more information on the CTeL website. In terms of upcoming events, next week we will be hosting a roundtable looking at the acute hospital care at home program and related waivers coming out of Congress, and looking towards what a post-waiver framework might look like and how the digital health community can get involved in shaping the future of hospital at home programs. We will feature some folks who are leaders in the hospital at home program, um, as well as leaders in digital health to talk a little bit about some of their insights on these programs, as well as foster a roundtable style discussion on the hospital care at home program, current successes, current evidence gaps, and where we can go from here. Registration is free. It is virtual and available to CTeL members, um, and that is also available on the website. And then the next day on May 7th, we will be having a webinar on remote monitoring oversight and enforcement with Natalie Dobeck-Lorenz, who is an attorney with Powers, Piles, Sutter, and Verville, talking a little bit about how the increased scrutiny of remote monitoring programs and remote monitoring billing from HHS OIG, um, what recent insights into how they're actually going about their investigations, some of the top billing patterns that OIG is looking at for its investigations, and what organizations can do to ensure that they are staying compliant with this increased scrutiny of remote monitoring programs. And so this webinar will be next week as well at 2 p.m. on May 7th. Registration is also available on the CTeL website. Also happy to drop the links to any of these events if you're interested in registering. And with that, that's all that I have for today's remote monitoring working group. Happy to answer any additional questions, or feel free to follow up with me by email afterwards if you'd like to set up some time to chat.
Thank you.
Thank you so
Thank you
much.
very much.
Have a great
Bye.
rest of your day.
You too.